Let's talk about the difference between tendinitis and bursitis. You always hear something, I got bursitis in my shoulder.
Right.
What is that?
Yeah, bursitis, they're between the rotator cuff and the bone above the rotator cuff, there's a fluid-filled sac called the bursa. And the bursa is serves just to be a cushion between the two bones, okay? And what happens is if that gets inflamed for some reason, an injury or just irritation, then what happens is every time you lift your arm up, it hurts.
Ouch, it hurts.
And that's bursitis. Now, if bursitis goes on further, then it can involve the tendon underneath and it becomes tendinitis. So you start with bursitis and then it gets worse to tendinitis.
What does the tendon do? Where does the tendon occur in a shoulder? What is a tendon?
Remember what we had talked about, the rotator cuff? And that's what the tendon is. It's a group of 4 muscles which attach to the bone, and where the muscle becomes a tendon, that's where it attaches to the bone, and that's where it gets irritated.
If that gets inflamed and it hurts to move, what do you do for it?
Well, I typically start with what's called an injection of cortisone injection into the subacromial space, which kind of calms down that tendon. The subacromial space is the space where that bursa lives, you know, between the rotator cuff and the bone above.
Is it easy to find it?
Oh, it's very easy to find it, and they're not nearly as painful as people think they are. You know, people are always very scared about that injection, and then afterwards they say, well, that wasn't so bad. So.
And the cortisone shot takes away the inflammation, and the shoulder is able to have physical therapy better?
Absolutely, and typically patients will get close to 100% better unless they have a rotator cuff tear. If they have a rotator cuff tear, they usually get better, but they still complain of that pain, and that's when I know that we need to get something like an MRI.